of issuing the RFP for some of the canceled contracts. I just wanted to give you a status update of, where we are with that now that, we've, come to that conclusion. So right now we're working with the regional office to finalize the amount of the funding that's available. What we're doing is doing like an annual amount. So if something was canceled in 2019, you would have 1 year's worth of that, to RFP out. And we're working with them, and we should have something in the short term to be able to provide you. And then what we'll have to do is we have to work through, a distribution methodology, whether it would be regional or statewide, and we have to have some more discussions on that. And I'm sure the council will have input on that. We can work through the regional office to get that. And then I think once we, do that, we have to understand what the needs are and get your input on that, and just to make sure that those needs align with where we're going as an agency in terms of our strategic goals and objectives. So I don't know if you had any questions on our status or any feedback that you wanted to provide.
I mean, initially, what strikes me is just trying to understand what's the timeline that we're talking about here. I would have thought that the amount of money that was budgeted or under contract would be kind of known entities, and these are numbers that we could easily kind of have looked at and started to devise a strategy for starting to move ahead. So I'm not getting that from you right now. So I'm just trying to understand, what kind of timeline are we talking about here? Because as I said, we've been on hold for a couple of years now, and this is the only way we have really to fulfill our mission of supporting families, based on their individual regional needs.
Yep, understood. I think what we want to do is make sure that, I know some of the funds have been moved around within contracts and within spending plans, and we just want to make sure that, we have a consistent understanding of, what was canceled and the reason why, and that is consistent with what the regional office has. So we have 2 sets of numbers already, and we're just comparing them. It should be done in short order. We're not speaking months. It's more of us just finalizing that information for you.
Okay, so we're not aware right now what the budgeted amount, just that top line number of money that would be the overall amount of money available by region. We don't have that number at this point.
We don't have a finalized number at this point. We should have it within a couple weeks, and we can distribute that information.
Comments from the members?
Margaret has her hand up.
Yeah, Margaret, I'm sorry, yeah.
Yeah, when you talk about regional versus statewide as a methodology, I'm not sure what statewide would mean. That there be one RFP for the entire state and providers would submit proposals to the state versus doing it regionally. I'm not sure how that would play out.
I have the same question that Margaret has. I mean, if our historically mandate is to try to understand and meet needs on a regional and local level using resources that are regionally and locally available, so that we can quickly and efficiently stand up these programs and get them moving. I'm not understanding. This to me seems to be like, a shift in the way that, FSS fundamentally functions. If we are trying to take what was always been a regional and local effort, and then trying to somehow turn that into a statewide paradigm, I'm not sure how that looks, and frankly, why something like that is on the table at this point.
And I think that's the conversation that we wanted to have. I know that traditionally it's been done regional. We just wanted to make sure that that is still the best, strategy to go forward to make sure we're aligning with our goals. And I don't know if, from a programmatic perspective, if, Alexis, you had any additional feedback on that, but we'll certainly take the council's, feedback and opinions into consideration.
Yeah, just following up with what Christine had said, obviously no decision has been made. It was just something that was posed to understand the direction we're going in. We've got the 507 plan. We've got a lot of strategic initiatives trying to focus on what potential new gaps exist in the service system instead of that continued, reallocation in the traditional areas that we've kind of seen them in FSS. So we're just trying to be a little bit strategic here and understand, is it still meeting the needs within that region? Does it look the same, or can we think outside of the box and really fully understand what the gaps in services are that FSS funding may be able to fill, whether that's at a regional level or a statewide level? It's just kind of understanding, like, are there similarities that are happening across the state that makes more sense to go that way? And Roger, I don't know if you were going to say something.
Yeah, I would just say that it sounds to me like we need to have that conversation. I think we do have an enacted budget, right, which is the first step to knowing what resources are available. And I think within the next couple of weeks, it sounds like we'll be able to have, figured out, how that translates specifically to this program. And then, I believe within the same time frame, we ought to be in a position to issuing a draft, 507 plan. So what we're really trying to do is make sure that, these funds are used in a way that best meets the unmet needs of the families and individuals. So, whatever the mechanism is that achieves the best goal for those people is the one that I think we want to pursue. I want to mention that, so there's, I guess, a lot more to come on this. I think the next step will be next couple of weeks. It sounds like we'll be in a position to share with the committee and then with the committee, I guess, through you, down to your local committees, what those fiscals look like with the enacted budget, and then have those conversations. And certainly there's no decisions that have been made whatsoever. It's very much of a, let's make sure that the way we do things makes sense, helps most people in the right way. I want to mention that the commissioner's other event has now concluded. She has joined us, the welcome commissioner. If we could advance maybe one slide.
Yeah. 1 second, Roger. I saw Deb, you had your hand up.
Oh, I'm sorry. I did.
Yes, I
didn't appear
did.
in my layout.
Okay, it's a little hard, and I'm doing 2 meetings at once. I just want to say that in the past, we, the advisory councils, were involved in gathering information, but lately, look, I will understand it because of COVID, but still, we feel that you're not listening and working with us the way we would like, because we're representing your customers, and they're the ones who contact us. So going forward, I do hope you understand the importance of working, of course, with the statewide, but also let the locals work all together so that we can tell you, because we have our own needs in New York City and we have differences in all 5 boroughs. So we need to understand, because I'm telling you, the RFPs, we used to work with the RFPs, we would work to make sure that the families were getting the help and services they needed. So I hope you remember that we used to, I've read RFPs. One year I had more than 250. I read them all. I didn't sit on every committee, but I read them all. We used to do site visits. Yes, I know COVID's interfered, but we need to keep, you need to keep us really involved so that we have a true understanding of what family support services is and how we can get it to work better and stronger. That's all I have to say.
Roger, it's Maria Suchi-Kozak. I just wanted to add one more comment to the process before you move on. I have a question, and the question is the statement on the slide, our strategic goals and objectives. I guess I would like more clarity on specifically what the goals and strategic objectives are that you're referring to. And also to Deborah's point, the needs. How is OPWDD identifying the needs of the families? As Deborah has pointed out, in the past, a lot of it used to come through the councils, and that seems to have trickled down. So what is the process by which you are identifying those needs is my other question. I don't expect the answers today, but I'd like, the committee to weigh in and OPWDD to weigh in on the process.
Sure,
Thank you.
and I can give a partial answer, which is part of this is where we flip the slides, and so when we're talking about the overall strategic goals and objectives, we're talking about the system goals and objectives that have been identified through the 507 planning process, which so this will make a little more sense when we're able to talk about that, those goals, because one of the things that we definitely work with a lot of folks, with a lot of stakeholder engagement over the last year, despite the limitations, obviously, of COVID and, how that impacts the ability to have certain types of conversations, to say, where do we want to be as a system? Where are we meeting people's needs? Where are we falling short of that? So, we want to benefit from that overall analysis, and then also, I think, benefit from, obviously, the more localized kind of expertise that, each of you has reflected upon. So yeah, I think a lot more to come on that. And, we certainly, and Alexis, I want to make sure that if there's anything you want to add into that before we sort of advance to the next piece of this.
I would like to, this is Mary Fasano. I would like to add one comment, and it really goes along with what Margaret was saying. We're talking about canceled contracts in regions. It was my understanding that the region was looking to reallocate monies that were already destined for that region. I don't understand this whole concept of bringing it all back and statewide. It's regional money, is it not?
Well, I mean, I think there's, year-to-year allocations that are made in the budget, for the agency as a whole, and then for particular programs. So I think there's a decision, and Christine, please correct me if I'm wrong, how that money then gets, allocated to specific, regional, contract opportunities. Is that fair, Christine?
I don't understand what you just said, Roger.
Sorry?
I don't understand what you just said. Wasn't there a pot of money awarded to a region, and the region allocated that through the RFP process? Along the line, contracts were canceled, money's turned back. Does that just go back to the state, or does that stay within the region for reallocation within the region to meet the needs within the region?
As the program was designed.
Roger,
Yeah,
this is Kathy Nowak. In the past, that's exactly what did happen. So if sometimes the councils asked to cancel the contract because they weren't meeting the needs or meeting what they said they were going to do. Other times agencies were done providing the service. They turned the money back in, and then we, Little Staten Island, would be able to reinvest those dollars again, or move those dollars because another agency was willing to provide that same service. That's how it worked. And going back, I don't even know how many years ago, when Evie was talking about where she lives, okay, that's, I think, Christy, right?
Yes, thank you. I've been trying to butt in, but I didn't want to cut anybody off. Thank you, Mary and Kathy.
Because agencies turned the money and they didn't want to provide the service. So they were trying to go through a new RFP process, and the region was told it's on hold. Everything was on hold. They were not allowed to do that. Another area of New York State did go through, and I feel like it might have been, oh, I forget who, somebody here speak up. They actually awarded the dollars, and those contracts that were awarded were pulled back. So there's a lot of different regions involved. My region is, I don't think any of New York City is, I shouldn't speak for the 5 boroughs, but there's, you have to find those certain regions and then give that region their money back that was given to them years and years ago.
Yeah, so I think
Go ahead.
I think that, you know, we understand how things have always worked, and I personally am still kind of learning all of the things that have happened before I came on board. And I know related to the RFP process, we understand there was a pause, and that stopped. What didn't stop was reallocating funds within certain contracts and looping the local council into each and every one of those decisions. That was never something that was made by the state. It was a local council decision that was kind of elevated through the RO and then signed off on by central office. So that has still been able to move forward. I think what we're trying to say today is OPWDD is supportive of resuming these types of RFPs. The mechanics still need to be discussed. We haven't even been able to review what that dollar amount looks like. So I think before we kind of talk about, you know, is it regional, is it statewide, we know how it has been before, let's just get the numbers and have that discussion to figure out what makes the most sense. And I think the commissioner's update on the 507 plan will be very enlightening, because that will help everybody kind of see where we're going to understand where this kind of fits into that larger picture.
So if I could maybe introduce the Commissioner Carrie Neifeld, and maybe advance one slide. We can come back to this if we need to, but I don't want to. Hi, Commissioner.
Hi, everyone.
Morning.
Morning, everyone.
So I think. So I don't know, Commissioner, if you want to take over the advance the slide directions. Thank you.
I don't think we have any slides for me, right? This is my only slide, right, Alexis?
Yes, right.
I have one very colorful slide. I will provide a brief budget update and talk a little bit about the 507 plan. I didn't plan to go into super depth about the 507, but you know, we can talk about it at a high level, and then we can talk about our plans for further stakeholder engagement, and obviously answer any questions that folks may have. So maybe we'll start with the 507, since we just referenced it so much during the previous conversation. I think everybody knows that over the summer, July and August, OPW undertook, you know, before I came back to state service, a really robust stakeholder engagement process where we hosted several virtual meetings, had an email box and other opportunities for stakeholder engagement to get a sense from the community, you know, family members, self-advocates, providers, anybody who wanted to participate, legislators, you know, members of other types of government, you know, to talk about the system of supports and services for people with developmental disabilities and where we want to see our system move in the next 5 years, which this 5-year forward-facing strategic planning is something that we're required to do by law, but also I think something that we have really embraced over the last, you know, almost, you know, close to a year, and really kind of taking beyond just what is required of us by law and really embracing it as a part of what we're trying to do as an agency and the way that we're trying to orient ourselves to move forward in a really progressive way for the people that we're serving. We got a lot of feedback back from all of our stakeholders, over 150 emails, you know, many white papers, you know, like I said, several hours worth of virtual meetings. All of that information was taken in, you know, evaluated, analyzed, and we began drafting the 507 plan, which has gone through several internal iterations. But now we are, you know, at the point of, you know, finalizing our draft. It's moving through the various approval processes, and the draft will be released to the public. We're shooting for mid-May to have that draft plan released to the public. And then we will then undertake another round of stakeholder engagement. So folks will have the opportunity to review the draft in its entirety. You know, it's a large document. We'll also be, you know, releasing plain language version. And again, we'll be hosting multiple stakeholder engagement opportunities, you know, 2 statewide regional forums, which will be virtual, and then a series of regional in-person stakeholder engagement forums. Again, we'll be providing opportunities for people to submit their comments through phone calls, emails, other opportunities for submission. We really want to make sure that we're hearing from everybody in every way that we can. The 507 plan will be provided in multiple languages. Our regional and virtual forums will be interpreted so that, you know, every community has the opportunity to really fully participate in setting the guidance and the direction of where we want to take our system. And so our goals, we organized the 507 plan through a series of goals and objectives, and our 3 overarching goals that we have put forward in the draft plan. And again, the draft plan is subject to everybody's comment, and the final plan will likely look different than the draft, but our 3 overarching goals that we've identified are goal 1, to support people in the most person-centered ways. Second goal is to promote practices that strengthen the workforce and the infrastructure. And goal 3 is to advance systems of change and innovation across the state. And so what you'll see for each goal are a series of objectives. I won't go into detail about every objective, but I'll just talk a little bit at a high level about, what each goal you might see underneath each goal. So for goal 1, when we're focused on supporting people in the most person-centered ways, what we heard loud and clear through our stakeholder engagement was wanting to see additional opportunities for meaningful community integration and participation, wanting to see, better services provided for children, youth, and young adults, wanting to see better support for individuals with complex needs, and wanting to really see the agency provide cultural and ethnically diverse supports and services to those communities who need them. Under goal 2, which was to promote practices that strengthen the workforce and infrastructure, really looking at, obviously our first objective is our workforce, right? And looking at ways that we can strengthen and secure and help advance our workforce. Looking at data access and transparency, and looking to have formal opportunities for stakeholder engagement and input and everything that we do as an agency. And goal 3, advancing our systems change and innovation across the state, really looking at, new opportunities to reduce the complexity of our system, improve the responsiveness of our system, and increase greater access for our system to the individuals who need supports and services. So we're looking widely at our supports and services and making sure that we're offering the right continuum of supports and services to the individuals based on their needs and abilities. Looking at our regulatory and policy practices, making changes there where necessary to help make our system less complicated, more easily accessible, and more available widely to individuals who need it. And then also looking at our research and innovation and really trying to strengthen the areas of research and innovation so that we can, both be operating the large system that exists right now in the best way possible, but also continuing to look towards the future and to understand best practices and to be evolving as a system and as a community in the way that we're supporting individuals and their families. So all of our goals, obviously, going through the lens of person-centeredness and wanting to support the individuals in the best way possible. There will be many appendices to the 507 plan. You'll be able to have an opportunity to look at a lot of data. And really, like I said, we see this strategic plan as informing our activities as an agency and as a community for multiple years to come. The good thing about the 507 plan is that it provides an annual opportunity for us to review our progress and to review our goals and objectives and make sure that we're still moving forward in the direction that we should be, make sure that we're holding ourselves and our community accountable to moving forward in this positive direction, and an opportunity to relook at the goals and objectives, and things change, right? I think, 3 years ago, we never would have anticipated COVID. And so had we had a strategic plan at that time, it would have had to adjust and change as a result of the pandemic. So, things happen, goals and objectives need to change and need to be adjusted, and we need to have a process that allows us to do that. So this document is meant to be flexible. It's meant to be a living document. It's meant to be a guiding document that helps us all to move forward, along the same lines. So like I said, we'll be releasing the plan mid-May. We'll be doing June and July, the public and regional hearings, and then in August and September, we will be, finalizing a final version of the 507 plan, which will be submitted to the governor and to the legislature. And then from there, we'll set forth on, a very regular process of stakeholder engagement around progress to these goals, and then updating the 507 plan. So why don't I stop there before I move on to the budget and see if there are any questions related to the strategic plan before we move on to talking about the budget. Was I on mute the whole time I was talking?
Nope.
Commissioner, you were not on mute.
Good. I hope someone would have interrupted me before 10 minutes had gone by.
So Josie, do we see any outraised hands from the committee? I don't see any.
Okay, then I'll look forward to everybody's participation in the stakeholder engagement. I'm sure you're anxious to get the document and to be able to review it. And we'll make sure that as soon as it's released, we get you a link to that so you can download it and get to work. So we're very excited about that. And then I'll just move on to talk a little bit about the budget. And, Christine, if I mess anything up, please feel free to interrupt me and correct me. So obviously, this is a really exciting budget year. The overall budget, the overall statewide budget is $212 billion, which is the largest budget we've seen in a long time. It invests in lots of ways in the state of New York, and I think specifically for us, it invests in this agency in a really meaningful way. We see a 12% increase to our agency budget this year, which is close to $500 million. And we're, just incredibly grateful to Governor Hochul and the legislature for that level of support and for really acknowledging the needs of our system for the first time in a long time. So workforce, obviously the enacted budget addresses the workforce shortage in several different ways. There's $300 million invested for several different initiatives. Probably the largest is the 5.4% COLA, which is the first, meaningful COLA that we have seen in over a decade going to our providers. The budget language directs that cost of living adjustment be first directed at the lower paying staff members of each agency before it's invested in other areas of operation. So we'll be working with our partners at other agencies in the division of the budget and the executive chamber to make sure that agencies, know how to invest that COLA and have the, appropriate resources to attest to the way that they're using it. But we're very excited about that. I know that was a key area for advocacy over the course of the budget process. Additionally, the budget provides recruitment and retention bonuses to healthcare and mental hygiene staff in both state-operated and nonprofit-operated settings. So that bonus is up to $3,000 based on an employee's time of employment and how many hours they work. And we'll see that broken up into what were, 2 different vesting periods, giving opportunity for providers to use that bonus in different ways. Providers would have an opportunity to use it as a retention bonus for staff who've already been there, and also potentially as a forward-facing opportunity for recruitment to, recruit new staff to come and work for them with the promise of a bonus if they stay for a period of time or work a certain period of hours. So we're very excited about that too when we're working out the logistics there, again, with our other partner agencies and the executive chamber and the division of the budget on how we'll be allocating those funds. We also have, for the first time in a long time, had the opportunity to invest directly in our state-operated workforce and the DSPs who work for us in our state-operated homes. We have had the opportunity to increase the rate of pay for those individuals. And also, we have been afforded the opportunity to continue paying them an increased overtime rate in recognition of how much overtime and how hard they've been working throughout the pandemic. And we're really grateful for that. In state operations, we have been plagued by the same recruitment challenges that our voluntary sector has. And geographically, we're dispersed across the state and face significant challenges. And we're happy to be able to support our state workforce as well as our voluntary workforce. Something we're very excited about is a real significant investment in housing in this budget. I see Alexis smiling. I know this is something she's excited about. Nearly $23 million invested in housing in this budget. $13 million will go to increase the housing subsidy amount for individuals who live independently through ISS or through self-direction program. This will bring up the housing voucher amount to be close to or tagged to the HUD fair market rent, which will allow individuals who use this subsidy to be much more competitive, when looking for apartments and when maintaining those apartments over time. We also provide nearly $10 million to restore previous cuts that were made to the room and board reimbursement levels in previous budgets. Additionally, we have the annual $15 million capital appropriation that's provided to help us continue our efforts to expand the availability of affordable and supportive housing opportunities, which we see as really, critically important. And, in the 507 plan, that's something that we heard a lot about, is really making that continuum of services available. And so we see this as a real opportunity to make a, wide continuum of services related to housing available to individuals. So they have, real choice when thinking about what opportunity makes sense for them and for their families. The budget also includes, investments in crisis services. We have $5 million earmarked to make permanent some of the actions that we implemented through our ARPA spending plan. We'll be continuing a 30% rate increase for intensive behavioral services. And we'll also be investing in county-based crisis supports with an annual investment of $3 million to help address gaps in local service provision. And we'll be working with the Conference of Local Mental Hygiene Directors and, of course, our partners at OMH as we work on crisis services. A big focus of Governor Hochul's and of our agencies overall is increasing employment opportunities for people with developmental disabilities, and we're excited because this year's budget provides $2 million, which will grow in out years to be $10 million, and an opportunity for us to issue grants to the field to work with individuals on skills development and other methods of training so that they are ready for employment opportunities. And we see this really as an excellent opportunity to fill the gap between what we can pay for through some of the Medicaid habilitative funds. This is really, meant to be outside of that and to really provide a real well-rounded opportunity to help individuals be ready for employment. And we're very, very excited about that. We've also been provided with resources to manage those grants, which is also exciting for us internally. We have the budget also allocates $30 million to OPW to make targeted investments in the Child and Adolescent Needs and Strengths tool, which is the CANS tool that we use to assess, children and help to best understand what their needs are and be able to support them in the best way. And $20 million each year to modernize OPWDD's IT infrastructure, which I know is an area that we have been behind and something that is often pointed out to us by our stakeholders, the challenges that we all face because of our aging infrastructure. So we're excited to be able to, begin to invest in and updating our technology platforms. The budget, provides $30 million in new state resources, which annualizes to $60 million to support new supports and services for OPWDD eligible individuals and their families. This is really to reflect on an annual basis. We see new individuals and family come into our service system needing supports and services, and the budget reflects an increase to accommodate those new individuals. It also eliminates Article 16 clinic utilization thresholds and their associated financial penalties, so we'll see some more flexibility for our clinic providers as well. I think just a couple other things that are very exciting, from the state of the state in the budget is the governor's appointment of Kim Hill as the Chief Disability Officer. Kim's a longtime disability advocate, worked in the Assembly for a long time, is well known to many people in our field, and will be working across multiple state agencies and within the executive chamber to advance really important issues of policy, certainly employment, transportation, housing, some of the big ticket items that we see, individuals with different types of disabilities, faced with barriers in these areas. And so we're really excited to partner with Kim. Kim will also be leading our Most Integrated Settings Coordinating Council, which is an area that we've always done a lot of work in, and excited to partner with her there. So I think, as you can see, the budget really provides really robust funding. A lot of that is in line with the goals and the objectives that are outlined in our 507 plan. And we're excited to see that level of support and that level of synergy. So happy to answer any questions if you have any.
Commissioner, one question on workforce. I'm just in thinking about, trying to create a more robust workforce. It seems that the big sticking point, I think, is increasing those long-term wages, right? Trying to get to a living wage. And I'm just wondering where the conversation is on that, if there's anything that you can share or anything that OPW or the state is considering that might bring some meaningful relief to that area of the challenge.
Sure, it's a great question, and absolutely was really the focus of a lot of the advocacy efforts leading up to the enacted budget. I think obviously the 5.4% COLA provides a really great opportunity for our voluntary sector to invest in their, the lowest earning individuals and their agency, which are the DSPs and the support staff who help to run those operations. And so we'll be looking to see our providers investing there. I think, we recognize that 5.4% is not enough to get to a living wage, but it's certainly a really incredible foundation for this year. That coupled with the ARPA bonuses that went out in, middle of March, and that providers will be allocating to their DSPs over the course of the next 6 months. I think we're seeing a lot of cash flow going right directly to our DSPs, and obviously the additional bonuses. So I think we have a very good foundation this year to build on, and next year. Obviously, we've been talking a lot about our updating our rate making methodology for residential programs. And I think we'll be looking to see there if there are ways that we can support, getting closer to, increasing wages for the individuals who work in those programs as well, based on, the need of the individual, right, that they're supporting and serving. So I think there's a lot of opportunity. And again, we budget on a year-to-year basis, so this is just this year's budget. And, that it provides a great foundation as we go into, additional years' budgets to be continuing to have these conversations that are really important.
Thank you.
Okay, it doesn't look like there are any other questions unless I'm missing anything.
Oh, Commissioner. Hi.
Okay, I don't see you. Please go ahead.
Okay, my name is Deborah Greif. I'm from Brooklyn, and I'm very concerned because something that the OPWDD you're not addressing, and I don't care if I sound like a broken record. Right now, if any of our individuals go to work and make $1 more than their mother and father, they lose their Medicaid waiver. And then they have to pay for their medical insurance. And since all of our children have pre-existing, not just the developmental disability, physical conditions, almost their whole salary can go to paying for Medicaid for their medical services. The ARC nationwide is advocating to make sure that Social Security laws are updated so that our children can go to work without losing their medical coverage. So I do hope that you will be working with us to make sure so that our children can work without worrying about losing their Medicaid waiver services and the medical care they need.
Yeah, I think it's a great point, and happy to have it be something that I personally learn more about, and we can think about ways that OPWDD can be engaged in the right activity around that topic.
I also want to update you on something else. In New York City, our former Commissioner for the Mayor's Office of Persons with Disabilities, Victor Calisi, is now working with Walmart, and he told me that Walmart is starting an advocating process to make sure that, and he said other mopeds across the state are trying to make sure that the Social Security laws are updated so people with, whether it's a developmental disability or any other type, can go to work without losing their medical coverage. So it is gaining national steam, and he did tell me that he'll be keeping me involved. And when I get more information, I will share it with you and everyone.
That'd be great.
Thank you.
Okay, I'm going to try this one more time. Is there any funding allocated to measuring how many disabled people there are in the state and how they're utilizing the services that are offered by the state?
I'm sorry, I could not hear the question. I don't know, did somebody else hear the question?
I think I heard, and let me know if I didn't hear all of it, but what it sounded like you were asking is if there was any way that we could understand the number of people accessing services and exactly what services they're accessing.
Yeah, not just how many people are accessing services, but how many disabled people there are in the state. What's the size of the population? What is the nature of the disabilities, and how many of those people actually have access to services?
So I think the answer is complicated. We have information about the number of people who are enrolled in waiver services, which is a different number than the people who actually access waiver services, which is a different number than the number of people across the state who have a disability, right? We at OPWDD, and Roger, please jump in and correct me if I'm getting this wrong, but we at OPWDD don't have a mechanism where we are aware of every individual in the state who has a developmental or intellectual disability. We are aware of individuals when they come to us, looking to enroll in waiver services. We obviously work closely with other systems, state education, but again, people are not required to report to us or to the state or to any entity about a disability. So we don't really have a mechanism for understanding statewide the number of people with a disability. There's proxies for that information, but no concrete number. And again, like I said, people oftentimes, will come through our front door become eligible for waiver services, enroll in the waiver, but not necessarily access services for various, reasons, because they, haven't yet, determined a need for services. Sometimes, based on, geographic or, service delivery issues, the services that they are looking to access may not be readily available to them, et cetera. So I think that, the numbers, are different depending on the question that we're asking. But I would say that roughly, yes, we know how many people, the OPWDD service delivery system touches or has the ability to touch. And that changes every year, based on need. I don't know, Roger, if there's anything you would add there.
Only that data is also publicly available, and your description of sort of how we know about people is, I think, spot on, Commissioner. But we have those kind of current numbers as well as year-to-year numbers available on our website. So we try to make sure that that's data that's available to the public.
So we still don't know how many disabled people there actually are in the state, but we do have a sense of how many people interact with OPWDD. Is that correct?
That's right.
Okay.
Just following up on that, just a little bit from an FSS perspective, do we have a way of knowing how many families or family-like units are in New York that are actually eligible to receive FS services? Do we have a way of knowing how many families or individuals might be qualified for FSS services and not waiver enrolled, because there's a gap of people that FSS could be their only lifeline to services?
I'm going to defer to either Roger or Alexis to answer that question.
Yeah, so I would say not really in certain ways, Chris, because it's a demand-driven kind of question, right? So if somebody may have a family member who has a disability, but isn't looking for any support for whatever reason, right? They may be getting the supports they need. That person may be enrolled in school, and that school may be providing the supports that are needed for that loved one. We don't necessarily in reach to say, hey, listen, can you proactively identify that you have a person with a disability? Our strategies are around making sure that folks know these services may be available. So the outreach is to try to make sure that, at different levels where people may be having contacts at school, at other types of settings, that, hey, there are services provided by the state that may be helpful if you want them, but it's once again it's driven by somebody saying, hey, I would like I need some help in some way. So that so the people who aren't looking for our services are people who are just living their lives, and so wouldn't necessarily be wouldn't be counted in our.
Yeah, there's that whole population that we can only model based on assumptions that we make, because they're not accessing the system, they're not trying to touch the system.
And I would mention, Chris, just one other point, and which is that we have been increasingly put an emphasis as an organization on reaching underserved communities. We have a significant, I think, concern that are we reaching all the communities in New York? Those who may be characterized by speaking a different language, or being in a culture or economic circumstance where they may not be fully aware of what might be available to them. So we're looking at a number of strategies to try to make sure that we're as effective as we can be in reaching underserved communities.
Yeah, and I mean that outreach is critically important, because I'm definitely a big believer in trying to provide services early in order to try to save long-term costs and burden that's going to be placed on the system. When we can make progress early, I think it saves a lot of money. One number that I think of a lot is this number of people who are eligible but not waiver enrolled, right? Because those are a group of people that are only FSS service recipients if they reach out and want to become those services. So, I mean, if we can come up with a number of people who are eligible for OPWDD services, right? People who have touched the system and said, yes, I want to be eligible, and they've received their eligibility. And then we look at the number of people who are waiver enrolled. That would be, I believe, another noble number. So that's spread in there. Those people who are eligible but waiver enrolled, is that a number that we can get to?
Yeah, I think that we can regroup with folks. It sounds like something that might be tracked at the front door level of kind of understanding, yep, you meet OPWDD eligibility, oh, but you're accessing FSS versus truly deciding to enroll in the waiver. So I think at least a couple of regions have access to some type of report like that in tabs, but let us just regroup and make sure that we have that consistently available.
Yeah, and as you know, I've shared some of these questions earlier. So I'm just, in my mind, coming from my background and perspective, to try to, be able to touch some of these fundamental numbers like headcounts and budgets seems to me to be like really important information that we should have before we start trying to, implement strategies, or even, times devise strategies, without these fundamental numbers in front of us. I think it will be helpful. So thank you. I appreciate that.
Okay, if there's not additional questions on the budget right now, I think we can move on to the rest of the meeting's agenda. Thank you, everyone.
Thank you. Can we go to the next slide, please? Okay, perfect. So I know that everybody is aware of this. We spent a majority of our last few statewide meetings reviewing the ADM and some of the feedback that folks had. So since we have met, we were able to issue the ADM for family reimbursement on March 10th. That is with an effective date of July 1st. So that is a very intentional effective date because there is a lot that needs to be done. There needs to be training. Folks need to fully understand what the requirements are. The FSS providers need to understand, the families need to understand what the process is, the application needs to be understood, and the fact that we have been able to create a consistent application across the board is really just pushing us in the right direction. So after that was released, we were able to train our RO FSS coordinators on March 15th, and of course we will have the provider trainings, the CCO trainings, all of that is going to occur prior to 7/1. And of course, we'll keep everybody posted when those trainings are scheduled. We typically like to target trainings for providers, but of course, it's open to the public. So, we welcome others to attend that as well. Next slide, Josie. So these are other areas that we have reviewed previously, but just to kind of highlight the most critical areas that are called out in the ADM is that we were able to land on a $3,000 spending cap that is consistent across the state. That does not include the emergency reimbursement piece that we had talked about previously and lives in the ADM. There is some oversight related to the ROs understanding the reimbursements that are being requested, and that is through a tracker so that the RO can understand if families are kind of seeking other providers, but perhaps they're seeking the same reimbursement for different providers. It's just to really make sure that we're optimizing our state funding and not having any type of, accidents or misuse there. There's prioritization within tiers that we have reviewed in detail in the past. Really helpful clarification related to what's allowable versus, more importantly, what's not allowable and what is included as an emergency. And some super helpful self-direction clarification because, that's one of those areas that was interpreted a bit differently across each region. So we're finally able to kind of get everybody on the same page there and be following one consistent policy. Josie, next slide. Okay, so this is the exciting stuff, and Nick please feel free to chime in if I missed anything critical here. But one of the things that was discussed in one of our meetings last year was at least one of them, the real need for us to have consistent information disseminated at the front door related to FSS. And I think, Chris, this really does go nicely to the point you literally just raised of, trying to understand if families want to lean towards FSS or want to move towards that waiver enrollment. This resource is going to help them in that decision making. So Nick had led a work group. There were statewide committee members. There were OPWDD staff who all worked together to land on consistent language that would be presented in the format of a brochure to share with the public and really be disseminated through the front door. So I do actually want to just go to the next slide to show folks what the brochure is going to be looking like. So basically, our communications team was able to pull the language that was reviewed on many meetings into a brochure format. So what we'll be talking about is just making sure that the RO directors have this so that they can really be able to disseminate that through all of the front door leads and have that consistently messaged moving forward. If we could go to the next slide, we can actually see what the content looks like. So, we wanted to explain who was eligible to receive FSS, what's available through FSS, and really importantly, explain what the role of the local FSS advisory councils are, which may even be able to serve as a tad bit of recruitment for the local councils as well. So, Chris, I know that you participate in this group too. I didn't know if you wanted to add anything related to the process or the product.
Yeah, I mean, with regard to process, I was glad to see, having the committee included at the onset of the project, as opposed to coming into a draft that had found its way through, a lot of time and a lot of discussion already internally. So I do appreciate that, and I think that's a good model moving forward, certainly. And I appreciate all the input from the committee and all the input from OPWDD on it as well.
Awesome. Thank you.
Yeah, so I'm sorry, one quick question. Let's just, would committee be able to get a copy of the brochure as it stands? Is this draft form or?
So I believe that it's in final form. What we'll do is as soon as we're able to share the final version with the ROs for that dissemination, we'll simultaneously send it to you for the sharing of the committee. So that'll be after this meeting. Is that okay?
Yeah, I mean.
Okay. Perfect. So if we go to the next slide, one of the other work groups that was created as a result of our meetings last year was focused on family satisfaction survey. So prior to us creating a work group to focus on this, there were at least 7 different family satisfaction surveys that existed, and it was kind of broken down by service. And that there are some families that are seeking additional services, multiple services, more than just one. So what we had wanted to propose was having one consistent survey that the providers are utilizing, and they can do that either, sending that out via mail or do an electronic survey. But Nick was able to lead another work group that was participated on by the statewide committee members, including RO staff as well, to just land on these top 8 questions that are really critical in understanding the effectiveness of FSS. So we've got these questions. The next slide kind of shows the rest of them. So I think we'll talk a bit more about how we're disseminating this to the field. It does kind of make sense to just attach it to the ADM so that folks are drawn to that as a requirement, to really just make sure that that consistency happens, and to make sure that families are not going to be burdened by receiving 17 different surveys. So Chris, I know you weren't on that one, but I didn't know if you wanted to add anything, or if any of the other statewide committee members who participated in the survey work group wanted to add anything.
Yeah, I mean, as you say, I did not participate in that, but in seeing it for the first time, from a marketing perspective, I'm glad to see that it's tight and concise and doesn't go on forever. I'm assuming that the work that was done on this was directed at trying to, garner the absolutely critical information that we need without going for a lot of extra that really tends to decrease the quality and the quantity of response. So from what I can see anyway, it looks good. And I'd ask the members of the committee who are involved to comment further. Deb?
The only thing I would like to see in there is, since reimbursement, a family support service, has nothing to do with programs, you didn't add anything like or like NA, because like, okay, staff, or like cleanliness of the program does not fit in for reimbursement program. So if you could somehow just like put even like a line, if this is a reimbursement program, and if they don't answer the other stuff, because parents will go, I just did reimbursement, and they don't understand cleanliness of program. Okay, if appropriate number of staff, quality of program, that you can. But certain questions are not geared for the reimbursement program.
Yeah,
That's the only thing I have to say.
That was definitely our challenge, Deb, is that there are so many different components that you can receive within FSS. So it's trying to create a catch-all. So I hear you. I think there are some items that are related to family reimbursement, like timeliness of services. Some of them may not apply, but the whole point was to try to create one consistent survey. So if it looks like it doesn't apply, that's something that a family can just kind of pass over, ignore. There is an other checkbox that can be selected as well.
Or do an NA, not applicable to this service.
Okay, we can definitely. Yep, we will definitely take a look at that.
I've had to do surveys with other services from other agencies, and they give you an NA, and then you just give a quick explanation. So like I would have checked off NA, why did a reimbursement program. That's it.
Okay.
Thank you.
There is one back for N6. If you see if it says timeliness to inquiries, questions, concerns, and reimbursement. So if it was a positive experience with the reimbursement, they could check that box, or if they didn't, if it was something they felt needed to be improved on, the same box as in number 7. So there is at least one that speaks to the reimbursement program in the positive or improvement categories. There's a lot listed there, so I just didn't know if you perhaps didn't see that in the review.
I just read everything fast.
Yes.
And I saw which can go for reimbursement and which doesn't. But I still know what will happen is we put this out. I'll get a phone call or an email or text. I just did reimbursement. What do I do?
Understood. Thank you.
You're welcome.
Thanks. Any other comments from statewide committee members who participated on this work group? All right.
I didn't participate. May I ask a question?
Sure.
Okay. So on the first page, I didn't see, is there a place where you write the specific program that you're reporting on?
Yep.
You still are going to need to send families 17 surveys if they receive 17 services, right? Because the agency needs to survey the family on their satisfaction. So they're still going to have to fill out the same number of surveys, right? And are you having them sent? What's the process? Are you going to have them sent to the DDRO, or are the agencies going to retain the surveys?
Yeah, I think we still need to discuss that because the requirement would really need to be outlined in the ADM, right? Like we want this to be required. Obviously, the FSS providers have contracts already that kind of illustrate what they need to do. A survey may be a part of that requirement. So I think we still haven't landed on whether or not that needs to go directly to the provider or the RO. I think it does make sense for it to continue to go to the provider. I think in some regions, they've kind of shared the summary of the surveys with the RO in certain instances when there's, you know, like site visits and whatnot. But it's really the ownership of the provider to get that feedback and understand how they're doing and what families are feeling they're doing well or not doing well. But that's a great question.
Exactly. In the past site visits, sometimes we found providers were not even looking at the survey responses, so they weren't getting the benefit of the feedback. So you're right, it's important to keep them there.
Yep. Thank you.
Thank you.
Okay, if nobody has anything else, then I will turn it over to Mary Beth from Council to go into the bylaws discussion.
Thanks, Alessa. I'm not sure if I have a slide or not. Thank you all for, oh, those didn't come out. Okay. I thought it was just going to be one general slide, but that's all right. So we've been asked to work on draft bylaws for your committee. And I want you to know that these are a starting and not an end point. There's a lot of information that's taken directly from your authorizing statute, but there's certainly areas for your committee to have input into what you'd like to see in the bylaws. For example, on this first slide, the highlighted sentence, again, that's a placeholder. There's nothing in your statute that talks about the terms of membership, so that's certainly something that you can discuss. Also regarding officers, I know you have a chair, you may want a vice chair, you may need other officers, and that certainly could be part of your bylaws and part of that discussion. You may want some subcommittees of your committee, and also how often you all decide you want to meet. And so we're happy to work on those. I know, I'm not sure how much has been shared internally with your committee. Happy to work on another draft and update that accordingly. And if you get those comments to either your chair, Chris, or to Nick, whose email I believe is at the end of these slides, happy to work with them and get another draft ready for you to review. I don't know if anyone
Mary Beth, just to be clear, you know, I think what our role here is OPWDD and what Mary Beth's role as deputy counsel for these topics is to provide support to the committee. So we can tell you, you know, there are certain things that are mandatory because they're in the statute, and there's certain things that lie within your own discretion, and we just want to be facilitative. We don't currently have bylaws, which is, you know, not a strength. So we would like to get to a point where we can fix that.
Is there expectation on the time?
Do we have to have bylaws?
Bylaws, or has any thought been given to that? Because I'm just thinking this, you know, filling in with the rest of the demands that are coming up on the committee, our lives, you know, and everything else that goes on. I'm just trying to have some understanding of what the expectation might be.
So I don't believe there's any technical requirement that there be bylaws. I think the challenge was, you know, we experienced collectively when a decision was made, when Margaret made the decision to step down as FSS committee chair, you know, there were no defined policies or processes for how a chair would be selected. And so, you know, I think people came to some agreement as to what would be a credible internal process in order to accomplish the selection of a new chair, but that's an example of where you know, having the rules kind of ahead of time is probably, you know, pretty useful. So I think it's really about sort of housekeeping, kind of, you know. We recently did something similar, DDAC, which is the Developmental Disabilities Advisory Council, where we didn't have bylaws. And once again, you know, just kind of defining what is the role of a committee, what is the role of a subcommittee, all those sorts of things. It's probably good practice. I don't know that there's any mandate that there be those, but I think that we certainly had a lot of challenges with making sure that, you know, when we had a moment of transition.
So the bottom line is we do not have to have them.
I think that's right, Mary Beth. I'm probably a step into your territory, for which I apologize.
Not at all. I guess my view would be that having bylaws provides your committee with some structure and some detail, how your group will conduct your business, and it kind of gives an outline for that process. So I don't see it as a negative, and certainly happy to, you know, make it fit your needs. It does not have to be a lengthy document by any stretch.
But there is structure in the mental health law, correct?
There is some. It's not. There's nothing clear on officers. Nothing clear on the terms of committee membership. Those are all things that could be discussed and put into your bylaws. You may want some subcommittees. There's nothing on how frequently you should meet. So those kinds of things are usually captured in a bylaws document.
It seems to me that there needs to be quite a bit of discussion among the members. If we go ahead with this, what this should look like. I'm just looking. I mean, what you have highlighted here in yellow. Are you saying that that's a needed component in bylaws according to whatever statutes you're looking at?
So that is a
suggestion?
term that's not included in your authorizing statute. There is no indication of how long a committee member should serve. So that's an option. This is just to show you something that could be, depending on what you as a committee decide.
But, you know, we have, and I'm sure we still have it in print someplace, the sense of terms, and it was a limited situation, except if the local council decides that they want their member to continue. So, you know, there has been, help me on this, Margaret and Kathy, that we do have those things in writing.
You're right, Mary. There was a booklet. I have it someplace. I don't know where it is, but it did say that members can be reelected by the local councils, and it did specify a term of office.
Yes, but one thing everybody's also forgetting is that we also used Robert's Rules of Order to bring some order, which says they do have a provision that say they so-called have term limits, but what happens if you can't get anybody to say become a chair, or you have nobody qualified to actually handle the responsibility of going up to the statewide? There is provisions where in Robert's Rules of Order where you're allowed to continue. So many councils have used the Robert's Rules of Order, which does help keep things in a steady flow. Because also sometimes you can take term limits and then nobody wants to do it because it's a very hard position. No one gets, you know, I have people asking me, am I going to get paid? And I go, no, we do this as volunteer. So many of us councils follow through the Robert's Rules of Order, which tells you how to, if you cannot get someone else to take the position, what to do. And I read everything you sent. Nothing was listed in there. And I have been on bylaw committees for community boards, precinct councils, PTAs, neighborhood advisory boards, and we always had to also have Robert's Rules of Order put in.
Can I make
This
a
is a
suggestion, Chris?
discussion to be
With your
had.
Chris, with your consent, it sounds to me I don't think we wanted to debate the specifics of particular bylaws, but simply to say, hey, this is a project that we think would be helpful. Deb, I think your comment about, should Robert's Rules of Orders, there's nothing in the authorizing statute that says that's the relevant thing to reference, but that's certainly something that could be part of the conversation. What we did mechanically is we took the bylaws that have been adopted by the DDAC, marked them up in some way to send them to you so you would have a framework, because it seemed easier to give a framework than to say, here's a blank piece of paper, react. Chris, if it makes sense to you, my suggestion would be maybe for you and either, and some of the FSS committee members to kind of engage and then have some conversation. It sounds like that there needs to be that conversation amongst the committee when we're certainly, and then maybe that we return to this as a committee of a whole next quarter, and maybe, there can be some time to do some of that conversation in the interim. Does that make sense to you, Chris?
That makes sense, yeah. Why don't we, we've had some initial discussion about, do we want bylaws, do we not want bylaws? That went on, some time ago. Why don't we just take it back to committee, start detailing what the questions and concerns are in a little bit, more succinct way, and try to begin to understand it that way. And then, if we can, work with Mary Beth, or work with her through Nick, whatever works better. I think that's the thing to do at this point. We can, work on the details internally. There's a lot of hashing out that I think will need to happen, and we certainly don't need to do that today.
Right.
Wonderful. So maybe if we could.
Roger, before you
go ahead.
I found the booklet. It's called it's OPWDD's Family Support Services Advisory Council, and there is a section on the Statewide Family Support Committee, and it does have some guidelines in, like the ones that referred to. So that needs to be taken into account as well when you do that.
Yeah, I mean, I'm sure a lot of resources out there. There's a lot of, I believe most of the local councils have their own set of bylaws that will want to make sure we're not trampling on or trying to override or overrule. So yeah, there's a lot of questions. This is, I think, a process that's going to play out over a number of quarters, perhaps, until we arrive at a document that everyone's happy with. But I do think personally it would be good to have some form of guardrails to understand procedurally how to move forward. Should we need a new chair? Should we need something of that nature? So.
Right, and we do have the tradition, obviously, of recognizing the vote of a local committee in designating that representative to the statewide committee, but I'm not aware of any writing that's current that actually says that's the way to do it, right? So we probably want to make, who is the committee is a very important question when you're trying to meet with the committee. So maybe if we can just advance through these slides, then with kind of tabling this. And I think when we started this conversation with the DDAC, it probably took us about a year to get to I would stop there at conflict of interest. It took us about a year to get to a fully enacted. So I think there will be a process here that's going to last a little while. I wanted to stop there and go back to Mary Beth, if that makes sense, just to talk for a second about the conflict of interest policy and procedure, because this is related to, but also slightly independent of the bylaws question. Mary Beth?
Sure. So it is within the draft bylaws, and I know you'll meet and discuss those. It's based on, this policy just kind of sets out a little clearer the actions that are taken by the committee to consider conflicts of interest that may arise in particular matters you'd be discussing. trying to keep the committee members all objective, fair, and impartial in any recommendations that they make. So I won't go through it all. Again, this may be something that Chris wants to have with his committee to discuss the actual policy itself, which just talks basically about what is a conflict, how do you disclose a conflict, and how do you recuse yourself from a particular matter that would cause a conflict for you. And then just a declaration that we're going to ask, we're suggesting that members sign every year outlining where they've already identified those areas that they would like to stay away from to avoid potential conflicts of interest. And I don't know, I think, Chris, you've seen that document. Is that correct? Did that get sent to you, the policy and the declaration itself?
You're asking me, Mary Beth?
Yes, I'm sorry.
Yes. Nick forwarded the document as well as the policy, and I did share that with the committee.
Okay.
And received.
And just to be clear, that's something that we've adopted with respect to the DDAC as well, and you know, we actually modeled it on a sister agency's disclosure forms. Once again, it's just, you know, for a way of making sure that, you know, people are acting in the best interest of the whole, and it's just kind of good committee or board, you know, hygiene, if you will. So I don't know, I think the next slide is on the same topic, if I'm not mistaken.
Right, you can probably skip ahead. Yep. I'd be happy to meet with you and discuss them as your committee takes a look at them and has questions. You can just keep going through the slides.
So that takes us to our next topic. And Alexis, I don't know if you're queuing that up for the DDRO or Anne-Marie Peterson.
Before we actually get to that, I just wanted to go back to like the process for sending feedback or reviewing that. To your point, Chris, if you can do that through Nick, and then Nick will, you know, keep in contact with Mary Beth. I just want to make sure that he's looped in on all things FSS.
Oh, okay. You good for me to go, Alexis?
Yeah, go ahead.
All right. So I was just asked to speak about the DDRO's reorganization. As you all know, because you're members of our councils, you know, we have our 5 regional field offices, and they support the 13 districts throughout New York State. And, you know, the regional office, we've always been evaluating and looking for ways to be more engaged and be more responsive to our individuals, our families, our stakeholders. And it's very important for us to ensure, you know, our families and individuals experience from a customer's perspective. We want them to, you know, have a consistent experience across the service system. You know, we're always trying to maximize our expertise, our historic knowledge, making sure that we're taking best practices to become the norm for everybody's experience, no matter where you are in the 13 districts. So to accomplish that, you know, one of the ways we did is how we organized ourselves. I wanted to make sure that each of our regional field offices were organized in the same way. So, you know, it was easier for individuals, families, and other stakeholders that we work with to reach us, to communicate with us, and to really, you know, have it flow in a manner that makes sense. So I think there was questions about, you know, where Family Support Services lives. And, you know, we look at fiscal is where our contracts, you know, our state paid kind of services kind of fall under, which would include Family Support Services. You know, there really hasn't been a change really with the staff that you're working with, unless there's been retirements, et cetera. But that falls under our fiscal division within the DDRO. The other divisions, there's 9 of them. We have our eligibility that really works with individuals coming in new to the system that need eligibility. There's our front door division that does intake and the initial service authorization. We have our waiver division that does do our waiver enrollment into the home and community-based waiver, as well as any service amendments if they're looking for something different. Our self-direction team. We have our housing that really oversees both certified residential housing and people wanting a housing subsidy. We have our crisis division that there are crisis IDD services and traditional crisis support where our staff work with a lot of care managers, et cetera. We have our development that is really related to our our DAHAB programs when they, want to expand any new buildings, property and mergers. And then we have a quality management technical assistance that is really about supporting and answering questions and, just working with our providers on stability. So those are how we've organized ourselves across the 5 regional offices. We've been engaged in this reorganization for well over a year now, but we were, fully implementing this at the beginning of this year. So I'll pause there to see if anybody has any questions about, what we did, why we did it. It was really to make sure that we were given a consistent and being responsive to all our stakeholders.
Yeah, hi, Anne Marie. This is Chris. From what I understand in talking with our RO is that the FSS program is going to fall under the Quality Management and Technical Assistance team. Is that correct?
No, that Family Support Services falls under our fiscal arm because it's where the contracts are.
Okay.
Right. So I can follow up. We can talk offline of who communicated that to you. But we can follow up on that. But it's part of our fiscal. It's where our contracts live and then the members that review and oversee the contracts, the support the council is in that arm as well.
Okay, and how do these, programs, these teams interacting? Is there a lot of interaction? I'm thinking in my mind when I think about family support services, right? And maybe thinking about things a little differently than we've thought of them in the past. And contracts, fiscal, that makes sense. That part of it makes a lot of sense to me. At the same time, when I think about family support services and families supporting their developmentally disabled loved ones at home, I'm almost viewing like family supports as supporting what may be perhaps the most utilized housing option for developmentally disabled New Yorkers, which is to live at home with family or family type units. And I'm wondering what you.
So there's a lot.
Anyone kind of thinks about that idea, because I think there's a real intimate relationship between family supporting loved ones at home and their ability to continue to do that, and the demands placed on the rest of the housing system. So I would think that trying to understanding better how all of those work together, I think might help promote long-term stability for the entire system.
So let me be very clear. There is a ton of coordination amongst the divisions. They're definitely not siloed. And I can give you many examples. Like we go out to, school districts, we go out and do, communication and education all the time with local government units. And we bring members of both eligibility, front door, our local school transition coordinator that, is with our waiver division, our family support member, we come out as a panel, we work together. Even in our, when we deal with our crisis team, our crisis support, even if you're not in crisis IDD, but we know of a crisis situation, our crisis liaison will be reaching out to the family support liaison about programs. So they're not siloed, it's kind of where ownership is and where they are, and we wanted to be consistent. So no matter where you are in the state, that if I want to talk to the family support liaison, this is where they are in the regional office, right? We didn't want someone in one region to be, it's here, in another region, it's in this other arm. We wanted that consistency so people knew where they could go to. But you're absolutely right that when you think of a person and their interaction with OPWDD, they can be in contact with 5 of the 6, 5 of the 9 divisions, at the same time. And so we have to be in communication at the same time. So there's no doubt your point's well taken and well understood.
Great. I just wanted to understand that cross communication is something that OPW has really baked into the system.
Absolutely. And I can honestly say with this reorganization, we've had more communication about that as we've teased ourselves and try to align ourselves similarly. It's opened up more communication, right? And so I think that's a big plus.
Yeah, that those channels become clear to everyone.
Yep.
Okay, thank you.
So my question is, will these different divisions also have support from advisory councils and from family members?
Yeah, well, yes. I mean, we're in every arm, we're very much engaged with families and individuals and getting feedback, right? So, I mean, these we work with our self-advocates a lot, and a lot of our communication and a lot of our trainings with the front door and the arms. So we do have that engagement. Okay. Do we have a council? Do we have a council like FSS? Not necessarily. The workflow is not, it's more individually based than a committee kind of membership, but we do have engagement regularly.
And how's that communicated to family members that they can be part of that, giving feedback and engagement?
So we, our front door, we have the info line comes through them. There's, part of the front door number that we have is a direct line to our facilitators and for that communication. So, concerns, interest comes in and are regularly delegated to each of the arms as it's related. So if someone calls our front door line and has questions about eligibility, they're connected with our eligibility team. And you could go, if someone contacts about housing, they're connected with our housing members, et cetera. So we established that front door line early and made it a number that was easily accessible, so that they could be easily found, and it's regularly utilized. So we have that engagement.
This is Kathy. No, I just want to make one comment. Although I understand the importance of the DDRO reorganization and the benefits, just a comment, and I don't even know, I think some councils did this. I'm not sure. Again, there's no bylaws or demands, but there was an expectation that our family support coordinator was available to us when needed, as needed. And fortunately, and I've gone through a number of, our councils has gone through a number of family support coordinators, and not as much as some others I know that go back and forth, but every one of them amazingly came to our monthly meetings and would be our person who we were able to communicate. You're local, you're a community, and having this reorganization, our person in charge or our contact persons are from Queens, totally different borough that is not familiar with Staten Island at all. So we lose something. So I just thought it'd be important to realize that we do lose something when we do this regional DDROs, one designated person for your local, my borough, who has no idea about our borough. So.
Yeah, and I think that,
Go ahead. Go ahead.
I was just going to say, I think that it's a reorganization so that we're moving in the right direction, because we have a lot of different things that are happening at the RO level. There might be some growing pains as a result of that. That's what I'm hearing. And that makes complete sense. But I think to just build off of something that we talked about previously on a past meeting, of just really making sure that we're crystal clear on what the role of the FSS liaison at the RO level is and what the role of the local council is and the chairs is, it's great that there has been such involvement at the RO level in the past on those monthly meetings. But what we've tried to reiterate in the past is, we want to be prepared for that, though. The RO shouldn't be the one who's setting up those meetings, creating the agenda. That's really the role of the local council. So I think to your point of that knowledge that might be missing, that it's going to take a little bit of time for whoever that person is to come up to speed, but that's the collaboration and partnership there. It shouldn't be too big of a loss because that RO is not the person leading those local discussions. It's the local council. We're kind of supporting that how we can, but we're kind of filling in and learning as we're going there. I don't know, Anne Marie, if you wanted to add.
No, I wanted to piggyback on that, and just from, my own experience, being with one district and then, growing in my role to a director that had multiple districts, and then now in my current role, I can say that, and I very much appreciate the intimacy that you're describing of having, someone know Staten Island so well. And I do believe that the family support, staff in Queens will learn about Staten Island. And what I hope and what I've seen from experience is that we have really creative, great ideas that happen in all nooks and crannies throughout, and that collaboration and that opening up of engagement is we learn from each other of experiences and ideas that have happened in other places that can benefit Staten Island, and perhaps Staten Island can benefit Queens, right? And so that coordinator from a regional perspective can bring those best practices to the committee, share some knowledge that you may get at these statewide when you come to statewide meetings too, right? But can also do from a regional perspective. If you find that, the growth that Alexis was talking about, that we do expect some growing pains with that, but we also expect a lot of benefits. If you find that that's not occurring, I would really like to, get that feedback, because the intent is for this to be a better experience and to promote, further engagement, collaboration, and communication. We can re-engage on this, on the experience, and if we're making the progress that we're intending to do.
Just a comment that we didn't expect our coordinator to plan the meeting, set up the agenda. They came as a resource to us, and we as a resource to them. So if something was happening at the state level, that we would hear that. If questions came up, they would find answers for us. They were part of a team. We were not expecting them, and we didn't. We did our things. We set up refreshments and whatever. So it's just, I think you hit it where you said the intimacy and the understanding and nice relationship that we had. That's what's going to be missed.
Is there any other questions or comments? So thank you. We can stay in communication.
I just have a quick comment. I'm with Kathy Nowak on that, because if you want Queens and Staten Island and Brooklyn FSS coordinators to help each other and learn, you can have your own periodic meetings. But when it comes to FSS coordinators, the regional office, the way they help is a different way, not planning a meeting or doing an agenda. That has nothing to do. I don't remember if I've ever asked, but they have a grip on the services, the support, the agencies which offer those services, because they really know what's going on. And moving around to different coordinators, making them up to the par of other, that's part of, that can be done through periodic meetings and other, but focus should be on regional DDROs, whoever is the FSS coordinator, that should be given a full responsibility. Yes, they can, the other boroughs, they can, the regional office can help, but the focus should be on that. And secondly, talking about the conflict of interest, I see that I found an email that was sent April 2nd, 2019 to all the statewide members. And this was sent by Dixie, that in order to avoid potential conflict of interest, would you please let Dixie know that if you are employed or are on any board, any agency that provides waiver services, Dixie's email address is above. So it's not that things were not done to all the process and procedures which is already, set forth. I just would say we should not reinvent the wheel. We should just sit down as statewide members, discuss with each other what needs to be done, and then bring forward to Nick, and Nick can bring forward to, it's just my suggestion. Thank you.
Thanks, Aaliyah. All right. If there are no more questions for Anne Marie, then I think, Chris, the next item was actually turning it over to you and having the statewide committee updates.
Thanks so much, Alex. I don't really have an update per se. I know that the committee has done a lot of work on the ADM, and I think our discussions will continue to be ongoing, and hopefully we'll be continuing to provide feedback and ideas on that as well. I did want to take, if I might be indulged, just a few minutes to kind of share, as my first meeting as chair, my kind of top line view of position and of the committee. I appreciate the opportunity. One thing that I truly believe is that much of the positive change we are able to achieve in this world flows from the relationships that we're able to form as we strive to achieve common goals. I've been really fortunate over the past several years to be working with an incredible group of Family Support Service Advisory Council members, statewide FSS committee members, and a number of other stakeholders in the FSS community, many of whom are themselves family caregivers. This group has inspired me, supported me, and really taught me a lot. Even so, as I'm taking up the role of chairing this committee, I feel like there's so much for me to still learn. So I'm really glad to know that I can continue to count on my community for support, insight, and the kind of expertise that can only come from people who have been intimately involved in this program for years. One thing that I do know, though, is that being a family caretaker who supports a developmentally disabled loved one at home can be very challenging. It often comes with ongoing physical, psychological, and financial stress that at times can certainly seem overwhelming. As we move forward, I want you all to know that I'm committed to helping to shine a light on the challenges that many of our families are struggling with. I'm committed to gaining a better understanding of how to reduce the impact of these challenges on the health and well-being of families across New York State, and I'm committed to advocating to make that critical support a reality. I know that accomplishing these goals will require the cooperation and collaboration of a broad and diverse coalition of stakeholders working together tirelessly in an effort in an environment of trust and mutual respect. I know that families, biological and otherwise, who are supporting their developmentally disabled loved ones by keeping them safe and living at home are foundational to the success of OPWDD. Supporting us is not only the right thing to do, but also, I believe, the best way to improve the long-term outlook for the systems of care that support some of our most challenged New Yorkers. Because I know that making families stronger will make the system stronger. And finally, I just want to say something to my daughter, Catherine. She's an amazing young woman who too often struggles and suffers with far too many challenges, and who, despite all of it, possesses a level of courage that many will never know. Goose, you are the reason this role found me. I'm able to accomplish anything while performing it credit belongs to you. I am so very proud of you. So glad to have you as my daughter. Catherine, you rock. Thank you so much, guys.
Well, thank you, Chris. Commissioner, I don't know if you had anything closing. I mean, I don't think anybody can do better than that. That was beautiful. Thank you, Chris. Commissioner?
No, I would just say thank you, for the time everyone took this morning. Thank you, Chris, for taking on this new role and leading the committee. And I know we have a lot of important work to do, together collaboratively moving forward. And I'm, looking forward, and I know the team here is looking forward to continuing that work and being able to support each other to support ultimately, right, New Yorkers with disabilities.
We really appreciate that, Commissioner. Thank you.
Until next time.
Bye, everyone.